look great for the holidays. We have ways to look younger without undergoing the knife. And now it's time to focus on your youth. We are all looking for ways to look younger, right? Well, have you heard of the stem cell facelift? It's getting a lot of attention, and today we have someone with experience to tell us more about it. Dr. Jeffrey Ptak, a board-certified plastic surgeon. Good to see you. Thanks so much for coming on the show. Yeah, this is really interesting. You hear it and you're like, what is that? The stem cell facelift. What is it?
Well, it's certainly a term that you are hearing a lot, and to some degree it's a little bit of a misnomer, and that's why I really would like to clarify it. It's really referring to the use of your own body fat that is very easy to harvest and using it to replenish the volume that we lose in your face. Probably over 4 or 5 decades, from your 30s to your 70s or 80s, you're going to lose all of your facial fat, and that's why we look so old and aged and gaunt. Just doing a facelift, which pulls two-dimensionally, is only going to make you look tighter and more like a mummy, as opposed to a youthful, soft, round face. So using the fat from your own body gives you back that youthful shape.
Yeah, so those are key benefits too. And another benefit is it's going to last.
At least 50% of each session that we do is going to be permanent. So it probably makes sense to do a little bit, and this is sort of the baby steps approach to doing facelifts as opposed to a big makeover. Recent studies have also shown that you actually do get some benefit from the stem cells that come with the fat. It's everybody is so concerned these days about getting rid of your fat, and I think it's been a, really sort of a maligned tissue in our body. We found that it's now actually one of the most reparative tissues because of the stem cells that are in peripheral fat, over 500 times more than in bone marrow.
Wow.
So your adult stem cells are very beneficial. We can now actually harvest them and store them as well.
All right, let's talk about where you can use this fat on your face. We also have some before and after pictures that you can show us.
This first patient just got basically what I consider a volumizing facelift with just pure injections of fat that we harvest most of the time just under local anesthesia in the office, and injected around the orbit, the forehead, in the temples, the cheeks, and around the mouth and lips. And it gives a three-dimensional quality back to the face instead of just pulling tighter.
Yeah, you can really see in this picture too.
Absolutely, and it reshapes the face back to that youthful egg shape as opposed to, thinner, longer, kind of, hollowed faces that start to become bottom heavy because of the sagging from the deflation of the face.
Yeah, and how long does it take to do this procedure?
Actually, it only takes a couple of hours as opposed to sometimes 4, 5, 6 hours to do a regular facelift, and there's not one incision.
And what are we seeing here?
This is just some fat grafting around the mouth, a very subtle but a very nice result where just injecting along the nasal folds and into the lips gives just a little softer and less kind of a craggy look in the face.
That's a big place, I'm sure, that you hear from a lot of women is they want to get rid of that. And this is a big difference too.
And to be fair, she had a very minimal neck lift as well, but a very short scar mini neck lift to take out just that little bit of jowl. But the benefit of the volume is so much more meaningful than just pulling and tightening the skin.
And how does your practice, would you tell people, see patients differently?
Well, I'm not one of the big makeover surgeons. I just don't like that whole concept about, the TV shows, the extreme makeovers. I'm a baby steps type of I think, plastic surgeon, and I think that most women and now men would much rather go through baby steps to approach, their cosmetic
You want it to look
correction.
real.
Yeah, absolutely, and this is probably the best way to do it.
Now, we talked about the fat transfer. Why would you tell people that fat transfer is going to be a better choice than the traditional facelift?
Well, for 2 reasons. First, it's your own fat, so you're not buying commercial fillers at a very expensive price point per cc, because we'll sometimes use 20 to 40 cc's of fat in the face, and there's so much less downtime. You don't have to worry about incisions healing. The cost is a fraction of a traditional
That's
facelift.
a big deal. All
Absolutely.
right. Well, thanks so much for explaining this all to us.
Well, I'd be happy to be here. Thank you.
Very fascinating, everyone. For more information about anything we talked about today, all you have to do is go online, go to drptak.com, or just call the number on your screen.